Okay, I'm going to go ahead and get started. It is my pleasure to introduce my good friend and colleague, Dr. Robert Sinclair. He's a professor of industrial and organizational psychology at Clemson University, where he also serves as the graduate program coordinator for the department's PhD and master's programs. Bob is a fellow of the Society for Industrial and Organizational Psychology and the American Psychological Association. And he is also a founding member and past president of the Society for Occupational Health Psychology and the founding and current editor-in-chief of the journal Occupational Health Science. His research concerns the intersection of work and health, including topics such as understanding the role of economic stressors, such as job insecurity, debt, and perceived income and inadequacy in work and worker and workplace health. And also then in another topic area is building organizational climates that enhance workers' safety, health, and well-being, and organizational sustainability. And then a third major area is the impact of the changing employment relationship on occupational health and well-being, employment engagement, and retention and turnover. And before I introduce and turn it over to Bob, I'd just like to thank everybody for attending. This is the Oregon Institute Occupational Health Sciences, and we are now in the season of our seminars, which are offered almost weekly on Wednesdays at noon Pacific time. And there is a link in the chat to learn more about the upcoming seminars. And thank you very much. I'm going to ask that you place any questions for Dr. Sinclair in the chat. And unless they're urgent questions, I won't interrupt him. But if they are relevant and urgent, I will. Otherwise, we will address the questions, have a Q&A after he is done presenting. So with that, I think I'm going to go ahead and turn it over to Bob.
All right, thank you, Leslie. I'm trying to see if I can minimize my camera here. There we go. All right, well, I've had enough coffee that I'm going to try and get through this, in 45 minutes as instructed. Otherwise, you can just cut me off, I guess. But really happy to join everybody and to see my former colleagues in Portland. As Leslie and I were together from 2000 to 2008, and then I moved out to Clemson, and so I'm always happy to kind of see Leslie and Emily and everybody else out there, and grateful for the invitation. As Leslie mentioned, I'm a professor of industrial organizational psychology, specializing in occupational health psychology, and I'll give you a little bit of the history as I kind of get along. But one of the areas I've been doing a lot of work in over the last, maybe a couple of decades now, depending on how you count it, is on economic stress and occupational health. And sorry. Here we go. So really, I just have two goals for you. One is to talk about what I would just call 10 things to know about economic stress. And most of these are probably things that most of you already know, but I think I like to kind of lay them out to paint a picture. And in my mind, I think this set of issues is among the most important issues for occupational health and doesn't receive, the attention that it deserves. And as I'll point out to you, I think there's some things coming down the road in this country that are going to make these issues even more serious. And, that was before, all things in the government these days. And then what I want to do then is run through and just tell you very kind of a bunch of different findings from some of my economic stress research. And I'm not going to get into the details of any particular study. I'm happy to talk about, any of the specifics if you have questions, but I just want to try to paint a picture for you of kind of what my research program has looked like in this area. So I think most of you know, or at least some of you know, that occupational health psychology is really about applying psychology to improving the quality of work life and protecting and promoting the safety, health, and well-being of workers. So, with that in mind, we can say that a lot of what we talk about as current workplace trends reflect in one way or another, or connect in one way or another to economic stress concerns. Everything from the whole Great Resignation to now we talk about quiet cracking, I think, and people staying on jobs when they're burning out and experiencing serious health problems because of financial concerns or health benefits. The whole area of justice, equity, diversity, and inclusion, is sometimes people, reduce that to a discussion of issues of race and gender and perhaps sexual orientation. But there's, I think underlying economic themes and economic inequity and disadvantage that are really important considerations in that area. Of course, in the changing employment relationship, there's issues related to remote work and gig work and economic inequity and healthcare costs. One thing I'll maybe touch briefly on toward the end is I've been interested in wage theft as something that people haven't talked about. And of course, the whole rising use of artificial intelligence creates concerns about employment insecurity. And so I think there's, a lot of the contemporary issues that people who are kind of worried about occupational health are concerned with, I think are really, in my mind, at least either directly or indirectly economic stress concerns. The other kind of orienting thing I'd say is that a lot of what I'm going to talk to you about comes out of or at least connects to a review paper that Tahara Probst, who's at WSU Vancouver up in Washington, and then Baylor Graham, who is one of my former students who's now at Penn State. We wrote a review in the annual review of org psych and org behavior that came out in 2024, talking about economic stress and occupational health. And so if you're looking for a reference, kind of one reference to summarize a lot of what I'm talking about, I think this is a pretty good one. So the first thing I want to do is kind of talk a little bit about, sort of the who cares about economic stress and sort of paint a picture of why I think this area is generally important for you. And so I'm going to just do these. They're pretty, I think mostly pretty simple, but, I think just to kind of make a case for, why we should be thinking about this stuff. One is that the American Psychological Association does surveys every year called Stress in America surveys. And they've been doing these back to about 2007. And pretty much every year, there have been a couple exceptions, but pretty much every year, work, money, and the economy are among the top stressors for people. So the point being is if you're interested in work stress, that financial concerns and work are really, and I don't think it's surprising to say this, right? That they're the top concerns for people most of the time, right? And then I think if you look at the rest of this list, economic concerns affect many of these other top concerns that Americans have. And so if you're, to me, if you're concerned about stressors and how they connect to work, in terms of occupational health, economic stressors are like the number one thing, right? So I think it's important in that regard. Different and related data point is measures, there's been some research off and on about financial fragility. And basically the way that they operationalize that is if you had an unexpected expense, and these data I'm showing you here is $2,000 expense, what would you do? Are you confident that you could come up with the money? Would you have to sell one of your children? How would you deal with it? And what we find, at least these are 2020 data, so these are pre-pandemic, around 1/4 of the respondents basically said either they're certain they could not come up with that money or they probably could not come up with it. And so that, makes a point that many people are one financial shock away from essentially financial disaster, right? And that, we know if you look at the bottom of this image that that fragility is not evenly distributed across all people, so that we see women tend to be more financially fragile than men. We see African Americans considerably more financially fragile than whites. And we could probably think about other groups that fit into that too. But, I think this makes a point that this is just not something that's it's natural to worry about money, but many people are just one step away from having serious problems. And I don't have the data in here, but you've probably seen that the number one source of bankruptcy for people is medical expenses, right? And so I think for a lot of Americans, we're just one unexpected medical problem away from bankruptcy. So again, trying to reinforce the serious nature of this. It's not surprising to say that the relationship between economic stress and health is there, right? That it's been well established in all sorts of different disciplines. These are just a few examples of, probably hundreds of studies these days. And along with that, that much of the actual working, the US workforce is low income, even during recoveries. And so if you go back to your basic statistics courses and where people make a distinction between the median and the mean, these are a little bit older data now, but I think the general trend is probably pretty much the same, if not more significant. Where if you look at the average income in the United States is somewhere around $75,000, $80,000 a year. And that mean, though, is distorted by, a certain percentage of people who make very high incomes. And what it doesn't tell you is that around 25, 30, 40% of the US workforce is very low income. So here you see that if you're looking at these are Americans who are making below about $35,000 a year in household income, which is was not a lot of money in 2016 and is not a lot of money now. So that, and that's even during times we talk about the economy as being quote unquote good, that a pretty sizable percentage of our US workforce is low income. And we know that those low income, low wage workers, they face even more serious health problems than the rest of us, so that there are fewer health and vacation benefits, greater food and housing hardships, the proportional costs of what they spend on childcare are greater, their children tend to have more health and behavioral problems. And once again, we see if we look at these, that these data are not distributed equally across populations, so that these economic concerns, are particularly prevalent in certain subgroups of the greater population who are, oftentimes really suffering, even in a time where we might say that the economy is doing well, by standard measures. The Atlantic has a nice piece that's a little bit older now about how expensive it is to be poor, right? And the notion is that the idea of the poverty cycle makes it incredibly difficult for people to escape low-paying jobs, right? So that it's not just that you're poor and you pull yourself up by your bootstraps, but your boots may not have the straps to be able to pull you up, so that you can't afford any discretionary training that might give you an advantage. Oftentimes, low-income workers lack reliable transportation, either just to get them to jobs that might be a little bit farther away from home, and they may not have good public transportation in many U.S. cities that could help with that. They lack access to medical treatment, which then again makes it harder to work for people, and typically have lower schedule control, which is a health problem in and of itself, but it makes it difficult for you to do things like schedule interviews for a better job if you can't control your schedule, right? You can see other concerns like being able to make deposits on good housing, the quality of food that people can access, the interest that they pay on loans. All of these are more problematic for these lower income workers. And, so I think it's important to recognize that there's serious problems, and particularly for Americans that are kind of on the lower end of the income range, that they're really serious problems that are very difficult to escape from. I think we have to acknowledge that financial literacy is part of the issue, right? But I think, we have to be careful about, I think, how you attribute the causes of that, so that I'd present these data not to say that, if people have economic problems, it's because of their own lack of financial literacy, but that, these are data. And if you're curious, I've got the questions kind of buried in the slide, but It's can you answer 3 out of 5 questions correct on a basic financial knowledge quiz? And these are 2020 data, I want to say, that found that less than 60% of, a pretty large sample of US adults could answer 3 out of 5 questions correct. And, for those of you that are in college or teach college classes, you know that 3 out of 5 correct is not the greatest grade in the world, right? So we're talking, lacking kind of bare minimum financial literacy. And you can see that as compared, the highest rates are in Norway and Sweden, where about 71% are financially literate. And, so this is a mix here of where we have these serious financial concerns and people often, lack the information that they need to help them get themselves out of those concerns. Janelle Chung, who's now out in Portland, former student of mine, and I wrote a review paper. I think this has changed a little bit since then, but we wrote a paper pointing out that if you look at kind of the major industrial organizational psychology journals, and you look at some typical topics that people study, like satisfaction and support and job performance and retention, and you compare those to issues like poverty, working poor, low income, financial stress, that there's essentially no research, right, on this. And this has gotten better since then, but I think still that these concerns within our general area of organizational psychology and business, et cetera, they don't receive much attention, right? And, compared to some of the other stuff that people study, right? And, so that's been my motivation, is really, we study some work on economic stress and health, but what I've been really interested in is trying to make that connection to say, what are the consequences for organizations of having workers that have significant economic stress concerns? And I think that's where at least one of the gaps is in the literature opportunities. Within this goes back to really back as far as the 80s, the people have identified around 5 different types of economic stressors that we could study. It's Paula Voidenhoff, I think, has done this, and then Tahar Probst and I have written about this later, making a distinction between employment stressors, which are concerns about losing your job or your employment conditions, and financial stressors, which are financially related. And then they can make a distinction between objective stressors and subjective stressors. Okay? So you can talk about financial stress, and I'll define it as perceived income adequacy a little bit later, as subjective concerns about money. Financial deprivation is objective, lacking of money, such as living in poverty. Job insecurity is subjective concerns about losing your job. Unemployment, people that study that study your objective employment state of, have you recently become unemployed or reemployed? And then underemployment is basically working in a job that's below your level of qualifications in one way or another. So below your training, below your salary history. And there's both objective and subjective approaches to studying underemployment. So I kind of put it in the middle here. So a lot of the research that's out there, and what I'm going to show you mostly, is research that focuses on the subjective aspects of this typology, right? So looking at underemployment, job insecurity, and financial stress as 3 kinds of subjective financial stressors that we can focus on. For those of you that are academics, to me, like me, I think there's a bunch of interesting theoretical issues related to economic stress. Roy Baumeister published a paper years ago in general psychology about the power of negative stimuli, right? And I think this is a classic area where issues like pay cuts, job loss, worries about your job, those negative stimuli have much more powerful effects on us than pay increases, getting a better job, et cetera, in terms of your health. The classics in terms of social exchange theory is the notion that, we align our organizational behavior with how we're treated, and our compensation is a major part of that, right? Similarly, relative deprivation theory tells us that we assess our resources by comparing our situation to social reference, so that we can't just objectively say, if you're making X amount of money, then you're either doing well or not. in terms of health, because we know that people assess their situation by comparing themselves to other people. And it's those social comparisons that often have a more powerful influence. The last one I'll talk about is there's two behavioral economists, Mulanathan and Shafir, wrote a book a while back called Scarcity. And they have this, I think, really interesting idea that they call the scarcity mindset, which is basically that when we experience resource deprivation, it affects our behavioral decision-making processes. And, so money is one of the major resources they write about. And in particular, how people who are experiencing, what I would call financial stress, have a different approach to behavioral decision making. So one example is a short-term focus, right? And so that when we're under scarcity, we stop planning for the long term. And so they talk about that idea in terms of how people, again, get themselves out of poverty. That one of the things that's in the scarcity mindset is it becomes very difficult for you to sort of engage in long-term strategic planning because, the stressors of the moment really dominate your attention. And so that scarcity mindset issue is, I think, a really important thing to understand in terms of how economic stressors affect people's behavior. If you're interested in measurement, there's a whole variety of different kinds of issues in economic stress measurement. And I don't know that I will talk through all of these for you, but just to give you a couple examples, we can talk about the role of cost of living, which I think we all know. We can talk about whether you're asking people about their concerns about their present or what their expectations are about the future. There's distinctions between whether you're talking about people's ability to meet basic needs versus lifestyle wants. I've talked about the subjective-objective distinction, and I'll show you some of these others along the way. But if you're interested in measurement challenges, I think this is kind of a cool area to be interested in because you can't simply just ask people, what's your salary, and have that be effective, right? That there's a variety of different kinds of measurement concerns that come into play. This is one where I think, my occupational health colleagues, these are issues that we don't talk about, and I think they're hugely important, right? Retirement savings, I've aged myself out of that group, but these are some data where people suggest that about the average retirement savings of someone between the age of 45 and 54 is $103,000. That is nowhere near enough for you to have a comfortable retirement. And so this is a huge issue that's getting worse over time. Debt is another one where, student loans, we've had all these debates about loan forgiveness and politically seem unable to, or unwilling to do anything about it. But, the student loan debt is ballooning out of control. And, at the same time, we have a housing crisis that I think is well recognized where we simply don't have enough affordable housing across the country. And we combine that with limited wage growth, and it suggests that, all of these problems are likely going to get worse before they get better. And, for those of you in org psych or occupational health, there's all sorts of downstream implications of these issues for, the kinds of things that we care about, right? But we're not talking about them at all. And, so I think that hopefully you can go out and now talk to people about them. I also like to say that, there are reasons for optimism out there, that I don't think it's huge, but we've seen, growing labor action at major organizations across the country where I think unions are coming back into play a little bit. If you read, my journal, Occupational Health Science, that I'm the editor of, we've got a piece in the most recent issue that's kind of a discussion of the role of occupational health researchers in relation to unions, and it's kind of a collection of comments in there if you're interested in that. Those of you that attended the most recent Total Worker Health Conference, I think we had a presentation from a representative of the One Fair Wage program, which is in San Francisco. It's kind of a battle to end tipping. I think we've seen some movement around minimum wage legislation, and particularly post-COVID, I think, some evidence of rising wages, and I think recognition of well-being concerns and retention-related concerns, in our post-COVID world. I fear that in industrial psychology, a lot of that shifted to people thinking about artificial intelligence now, and to some degree, they've stopped thinking about some of these issues. But I think COVID at least, increased recognition of the importance of well-being, and we know that economic stress is a really critical influence on well-being. So I think there's some reason to be optimistic about some of these issues, I think. Okay. I'm never going to make it, Leslie. So what I'm going to do, and I'm going to try to do this quickly, because I want to give you just kind of a, the sort of the big picture. I think my research really asked three questions. What is the nature of economic stress? What are some of the organizational consequences of economic stress? And what are some of the contextual factors that influence economic stress? It starts for me going back to Jim Martin, a colleague of mine, and on my dissertation committee. And later on, after I graduated, he and I did this paper at SciOp where we were interested in unionized retail workers in Michigan at the time, and we were predicting objective retention length, so how long they would stay with the company. And one of the observations that we had is that there seemed to be some huge differences by income in the predictors of retention. And so the traditional kinds of things that we would study in industrial psychology, and these were like job satisfaction, work-family conflict, fairness, were much stronger predictors for higher income workers than they were for lower income workers. So it's just a kind of a collection of self-reported variables predicting objective retention length in the sample. And that really got me, is really, I think, the first study that really got me thinking about low income workers to a degree, and just this idea of focusing on family income as a major kind of explanatory variable. Then later on, I moved out to Portland State. Lindsay Sears was one of my doctoral students there, and her master's thesis developed a typology of subjective financial stressors that she called perceived income adequacy. And she basically kind of reviewed the literature and said that there's two main ideas: sort of people's assessment of their current situation and their future situation, and their assessment of their ability to meet basic lifestyle, I'll call them needs, like paying your rent, putting food on the table, versus what some people call desired non-necessities, the ability to go out and have a nice dinner every once in a while, or go to a movie, or whatever that lifestyle thing is for you. And then she went out and studied those, and basically, again, I'm moving quickly through these. We can come back if you're curious, but showing that, as you would expect, the PIA wants, in particular, mediate the effects of objective income measures and objective expense measures on financial strain, right? So that, objective income predicts people's sense of whether they can meet their lifestyle wants in this case, and that predicts the amount of financial strain they experience. In a follow-up study, she then showed that, both the subjective financial stressors and reports of financial strain, which is more of a kind of an emotional measure, predict things like job performance and life satisfaction. And this was a Chinese manufacturing sample. So just basically, I think that's evidence for the basic notion that we would expect that the objective experience of financial stress predicts your subjective experience, and that's what predicts outcomes. Okay? Another study from around the same time, we looked at perceived income adequacy and financial fragility as predictors of mental health and physical health. And we found a couple of things that are interesting. So this is people's current worries about their current financial situation, current reports of financial fragility, predicting depression, burnout, physical symptoms, and job engagement, right? What's also important and interesting about this study is that the objective measures didn't predict anything, right? And it may be that this is kind of a classic example of a mediation effect, but I think it is just evidence to show that, if you're concerned about health and worker engagement and those kinds of things, you have to look at people's subjective reports about their situation, not just either their income from a job or their household income. We've also done other research that looks at the extent to which perceived income adequacy is a function of kind of objective financial stressors versus personality traits. And this is kind of a simple little study, but I think this is kind of cool. So that this tells you the kind of the amount of variance explained in relative weights analysis by dispositional positive and negative affects, so the tendency to experience positive and negative emotions, and income, debt, and debt to income ratio for a household. And what we see is that if you look at people's current worries about their financial situation, it's about a 50-50 split, right? So that a good chunk of people's self-reports of financial stress are driven by personality, right? What's interesting is if you then start asking people about the future, 3 months from now, 3 years from now, the dispositional component of this gets stronger and stronger. And the kind of the objective component, in other words, the ability of your current objective financial situation to predict gets weaker and weaker. Still there, but it's weaker. So basically, it suggests that we have to recognize that people's subjective reports about their financial situation are driven by, what you might call extraneous factors like personality traits. And I think that's, important to consider when we're trying to build, accurate theoretical models. We've also then looked at other kinds of issues other than, just income. Kristen Jennings was one of my former students here at Clemson who led this paper, looking at both debt amount and what we measured is we called it debt complexity, showing that those predict financial strain. And then again, that mediates the relationship of debt with a whole bunch of kind of work-related outcomes. And debt complexity in this case was operationalized as the number of different debt sources a person has. And that, is interesting. I don't know that I would have predicted this, but it had a stronger effect on financial strain than even the person's objective amount of debt, which is kind of an interesting finding, and noting that's controlling for income and some other variables. So basic point is that we can't just study income. We need to look at people's debt as an important explanatory variable. We've done a couple of things lately looking at economic stress and opioid use. This is just one piece of it showing that in this case, economic stressors, here we see job insecurity, perceived income adequacy, household income, predict people's self-reported street opioid use, and that relationship is stronger when people report a greater dependence on their job. And then in a paper we just had accepted, Paige Watson, another one of my former students, this is in Business and Psych, we show that depression symptoms mediate the relationship of economic stressors to prescription opioid use. This is a nice 3-wave study, so it's a pretty cool study in Business and Psych. I mentioned Baylor Graham before. Her master's thesis looked at a life course perspective. And so, when Lindsay Sears and I started out with this, we were thinking about current versus future states and thinking about, how people analyze their future situations. With Baylor, we kind of went backwards in time and asked people about their childhood experiences and, looking at how those explain people's present day work-related outcomes. And basically what Baylor found is that disadvantages in childhood, including financial ACEs, are aversive experiences like abuse. And can you provide links? Yeah, I can probably accumulate them and get them out afterwards. And if there's anyone that you're interested in particular, please email me and I'm happy to share. But this is a model called cumulative advantage theory, which basically argues that disadvantages in childhood predict disadvantages in adulthood, and that explains why some of these childhood disadvantages predict things about certain kinds of work-related outcomes like job performance, burnout, turnover intentions, etc. So that I think so far, I think what we said is that subjective economic stressors are important, right? That they predict health outcomes, they predict organizational outcomes, and there's both looking toward the future and understanding people's past experiences, elements of those. There's another stream of this research that asks questions about the economic context that somebody exists in. And this is really Tahara Probst and some of her students have done most of this research, and there's a bunch of really good studies. I say if you want to feel bad about yourself, go look at Tahara's research record. But she's done a lot of work looking at kind of these economic and cultural contextual variables, predicting individual experiences. And so I want to tell you a little bit about one study we did that I think is pretty cool. We were able to get data with Lindsay Sears, one of my students, from the county health rankings, this is a freely available data set that Robert Wood Johnson puts together that gives you objective indicators of county health on, they may have added to this since then, but at the time it was 29 different indicators, and you can kind of see them there in 4 broad areas. And so that these are county level health data. And what we did is basically we were able to get data from all 3,000 counties in the US and then form a kind of an overall county health measure by standardizing scores on all of these and then just basically adding them together, right? So you have kind of an overall measure of county health. We then, do I not have it in here? Yeah, so we then were able to link those county health data to a very large survey of well-being conducted by Gallup. And so it was around something like 170,000 people. And my one little side note for those of you that are graduate students interested in research, every time I do a survey now, I always ask people their zip code. And why? And it's because if you can get zip code data from people, you can link those survey data, all sorts of other interesting data. And I can say more about that if you have questions about it later. But so we were able to link by zip code self-reported survey data to people's county level population health. And we found a couple of things that are interesting. One is that we found that the effects of job insecurity on, this is for social well-being, it was more harmful in healthy counties. So that we interpreted this according to relative deprivation theory, which is basically that when you're doing worse off than people around you, it tends to have more adverse consequences, right? And we found support for that idea with job insecurity. What was interesting is we found something opposite for income-related stressors, right? So that we found that the slope here for income-related stressors was steeper, so suggesting that those stressors are more harmful in unhealthy counties. And so we interpreted that as consistent with conservation of resources theory. And so, but basically, I think the point is that it shows you that the county context matters and shapes how people respond to their individual experiences. And it highlights the idea that income-related and employment-related stressors may have distinct effects and that you probably need to study both. Okay, so what do all these data tell us? Certainly that there's multiple kinds of economic stressors that are relevant to work and health. A lot of the research is focused on job insecurity and some form of financial strain. There's another stream of research on underemployment, which is important. We've been trying to extend that a little bit by introducing ideas like debt in there. In this research, you have to look at temporal considerations and think about not just people's current situation, but their expectations about the future, as well as their past history and how that affects their present state. The personality research suggests that there's individual differences and that, two people in the same objective financial situation are going to react differently to it. And so our scientific models have to account for that. And I just mentioned it very briefly, but there's a lot of research on county level, nation level, cultural factors, economic factors, social factors that show that we really can't study these things in a vacuum, that you have to understand what is this person's context that they exist in, because we know that that shapes the harm caused by economic stressors. Okay, just a couple of things that are coming down the line for me. With Tahara Probst and Mindy Schoss and I are wrapping up work on a special issue of the Journal of Business and Psych. We've just got, I think, one or two papers left that we're getting the final reviews of. So hopefully that'll be out at some point early next year. And, we kind of challenged, people submitting to this to provide, address lots of what we would see as unanswered questions in the economic stress literature. And, I can come back and talk about those more later if you want, but there's a lot of things that people can look at. And I think we wound up with a really cool set of about 10 or 12 papers out of something like 80 initial submissions, that survived the review process. And I think I'm excited about the issue. I think we've got some really cool science to share with our audience that should be out pretty soon. I'd also say, what am I thinking about these days? And I just wanted to mention a couple of things that are sort of in progress. One is that we've been gathering data on what I'll just call for now unethical compensation practices, such as wage theft, people not paying you the full amount that they should, manipulating people's schedules so they don't get, benefits because they're not full-time. Looking at attributions about the causes of financial stress, so that when do you blame your employer versus, just a bad economy, and what are the implications of that? We continue to work on this notion of a lifespan developmental approach, looking at, how childhood adversity and positive experiences in childhood affect people's current state, and what the implications of that are for their work experiences. And then I've just been starting to scratch the surface on a kind of a semi-related area for me is looking at sustainability issues. And one of the things I've been interested in is kind of what's the connection between economic stress and sustainability. And the first one of these is something I want to do soon, which is like looking at people's support for green initiatives. How does that relate to their financial situation? And we might argue because of that scarcity mindset that people experiencing a lot of financial stress aren't going to care about sustainability as much. And we've also got some other initial data looking at climate conditions like days of sun, days of rain, temperature extremes, predicting some of those economic stress variables, which is stuff that I still haven't completely figured out what to do with. But I think just some really interesting connections between things that people typically study in applied psychology and, sort of what's out there in our context. So I'll stop there. That's 3:44, so I think I did pretty good. And love to take any questions that you have in chat, or just hop on and shout them out or whatever.
Bob, I can't believe it. You did it. You did it. Less than 45 minutes. Yes, great job. Thank you so much. I'm trying to figure out how we can actually, if we can see, I don't know if we're going to be able to see our participants.
Should I stop sharing my screen?
We can try. Let's see. We can't see everybody. So a suggestion is either to unmute or to put questions in the chat, and then I will then rephrase or read the questions to Bob. While folks are thinking about that, I wanted to ask you. A bunch of things went through my head. I mean, obviously, I am very familiar with your work, but I also kind of high level. And in my own thinking about pay and job, so more of objective pay, I when I used to talk about workplace psychosocial stressors, I would talk about the traditional high demands, low control, low support, and I started really talking about low pay. And I don't think, kind of to your point, that this really hasn't been addressed in our field as much. I think in other fields it is being addressed more.
Yeah.
And that as we think about from an occupational health perspective, and we think about psychosocial stressors, we do need to consider, even though there is a difference between the perceptions of our pay and the actual objective pay, what the organization has control over is what they're paying people. And that isn't enough for many, many, many workers. And I'm wondering now, going back to kind of your work, have you done any work in the area of really working towards changing organizational policies and even compensation systems based on these data? So you have data on the harmful effects of low pay.
Yeah.
Obviously, we're talking about perceptions as well. But have you done any work that has directly related to kind of some potential policy changes?
It's a good question. It's one of the slides I cut was just interventions. You know, but just and largely because the answer is no, I haven't really done this stuff, but I think there's like, a lot that can be done. And so we write about, the distinctions between, standard public health model of individual, like preventative prevention versus, treatment kinds of things, and then sort of individually targeted versus organizational. And, I think it's like, I think maybe it's the area for me where I think organizations aren't going to do this stuff. It's like it's social policy is where you're going to see changes. It's like that's my, it's kind of a pessimistic view of it, I guess, in some ways. But well, I'll say that, and then I think that it's like we need economist collaboration too, because I think there's things like labor markets where you can think about some of these things might change within particular occupations as the competition for talent in those occupations gets stronger. But what you're not doesn't seem like we have any much optimism around is like lower income workers who really
I think that getting the work that you do and the work in this area out more broadly into mainstream to have organizations actually see that, okay, that because we see what's happening across in the country.
Yeah.
To really connect, the ROI, the return on investment, and show that when we are not paying people, this is creating such high levels of stress, and it has an impact on the bottom line through increased healthcare costs, decreased productivity, etc. Providing those data and making that case, it's I think it's going to be, it is so important because it's not there. Because workplaces think, okay, well, a lot of times let's just cut the jobs to save the money. That's not necessarily going to save money. I want to go actually, because now there's 2 questions in the chat. So I'm going to hop to the chat and I'm going to go to the first one.
I'll just say, Leslie, one thing really quickly. I think where you can find at least a little bit of data, it's hard to study, but there's some studies out there that have looked at sort of pre and post minimum wage changes.
Right. Oh,
that yes. I think help make some of the case for that.
Well, that's actually that's an interesting point. And my team is actually, because we're studying farm worker overtime, we've been thinking about that as well. So anyway, okay. I'm going to go to Erin Flynn's question. She said, great talk, super interesting. And she would like to know that kind of the main health implications of economic stress. If you could just kind of spell those out. What are the main health implications?
Well, I don't know that there's like one thing I would say. I think that the research links economic stress to, all of the standard things that psychologists study in terms of like mental health, I think would be my main focus. And then, I think there's like depression, anxiety, just the whole gamut, I think, is tied to these. And I think also, I don't have at my fingertips, the research in other disciplines that study some of that stuff more than I do, so I think, but you can look and, some of those other disciplines, and they've made connections, I think, between economic stressors and, a whole wide range of health outcomes for lots of different reasons, right? It's not just that worries about money, it's like access to healthcare, and kind of on and on. And I should say that, some of that research looks at bidirectional issues, so that our standard thinking about it is that economic stress is a threat to health and therefore it affects health outcomes. There are some studies out there that look at the opposite and saying that experiencing health concerns creates economic stress because you can't hold down a job. And, if you have chronic health concerns, that limits your ability to work and on and on. So in some of that opioid work we were doing, we looked at that kind of bidirectional effect and didn't find it. But, so it's not the range of those health consequences is not like something I can list off the top of my head, but there's just, you can find, a lot of studies on them. And it's kind of like, to the point, to me, it's like, it's so well established, I don't spend a lot of time thinking about it, I'm much more interested in like trying to make that connection to like work engagement and retention and some of
But the
those
health
things.
outcomes are related to the healthcare utilization, which is going to be important to the return on investment.
Yeah.
Okay, I'm going to pop over to Kent Anger's question. It's a little bit long. I'm going to just read it because I don't want to paraphrase. Said, you indicated that one's satisfaction with pay is often related to one's perceptions of reference. That is your coworkers and your friends' pay that you know about, which might be a rather small sample. But maybe knowledge of higher salaries from the company's CEO, which may be more widely known, may have a more powerful effect on one's satisfaction with their pay. I'm especially interested in how this relates to lower wage workers.
Yeah, so it's a good question, Ken. I think there's a couple things going on in there, right? I mean, I think that the idea of relative deprivation goes back to the 1950s and basically says that in a lot of different ways that we compare our treatment to people who are proximal to us, and and I think that that's a pretty well-established idea. And I think it also applies to things like compensation. And the example that's, I think, probably close to some of the people on here is if you think about graduate students making $15,000, $20,000 a year, if everybody else in your cohort is making the same thing, that's not quite terrible, but if everybody else is making 40, you'd feel differently about it. And then I think, but I do think your point, I was just talking about this in class last night, Kent, about, not necessarily this like CEO pay in general, but like the notion of what happens when companies give CEOs huge increases or bonuses in a context where they're not doing anything for their workforce. And we know that has its own set of effects. And I think the challenge is one of transparency, right? In terms of how much do those workers really know about what those top people are making. And I think in most cases, I don't think they really have any idea. And so maybe some more transparency might change that, but it's, I think it's hard to make it happen in practice, I guess. And I don't know that there's like a lot of research on it, but I do think it's something that it would be interesting to study more.
Great, thank you. All right, I'm going to go to one last question. This is from Emily Wang. Considering the complexity of economic stress, how might interdisciplinary teams, such as those in psychology, economics, and public health, work together to study it more effectively and support worker well-being?
Yeah, it's a great question, Emily, and I think it is, an area where, as an applied psychologist, I have some understanding of some issues, but, they say with age, you become just more aware of what you don't know. And I think that's, if, interdisciplinary collaboration is great. I think if you can't do that, at least it's like reading outside of your discipline, and trying to have a handle on some of the issues. And it's not easy, for the minimum wage one is a great example of where, there's a healthy debate in economics about what changing minimum wages does, and it's not like I don't think economists would say it's as simple as if you just increase minimum wage, everybody's happy, but I'm not the one to speak to the complexities of that. You need economists for that. And, so I do think this is a great area for that kind of multidisciplinary collaboration. I also think on the other side of it, there's people that know a lot more about the experience of low income work and poverty and, like in social fields like social work, for example, that, industrial psychologists, we don't get training on that, right? And, just learning about things like the poverty cycle and, I've got a colleague here who does some really interesting work on like neighborhood deprivation. and, which is like what happens when you live in an impoverished neighborhood, which is a whole nother set of concerns, right? And so I don't know that I have the strategy, Emily, to say that, yeah, these are the 4 steps that you use to engage in this kind of collaboration, but I think it certainly is something important, and it certainly is a classic example of an area where there's nobody in any one field that's going to, be able to master this kind of thing by themselves.
Super. So let me just have open it up one last time. If anybody would like to unmute and ask a question, you can do so. I believe you have the ability to unmute.
Do you share the slides with people, Leslie?
We can share the slides if you would like us to.
Yeah, I'd just say if somebody wants like one of the papers in there or something, please just email me. I'm happy to share.
Sure, I believe we can share it. David, can we send the slides out to everybody?
Yeah.
Okay.
Or we can post it to the website.
Okay, so you'll take care of that because you're in charge of that stuff.
Yeah.
I don't have to worry about that.
Is there do we have time for another one?
Yes, you go. You go.
So I have a methods question, and I see this is a very important topic, but my concern or my question is that everything is interconnected with everything. There's a lot of chicken and egg, and like anxiety relates to insecurity, and then insecurity to anxiety. So what are your methodological suggestions or cool ideas that you have to try to disentangle more causal effects, especially with health outcomes?
Well, methodologically, I think in terms of that bidirectional issue, I think it speaks to the importance of longitudinal research. So for example, in that economic stress and opioid paper, we could make competing theoretical claims about the direction of the relationship, but we only supported one, right? And so, but you can't do that unless you have good longitudinal data, right? So I think that, in terms of dealing with like the bidirectionality issue, that's important. I think the same is true about you can feel my brain leaving outside my ears right now. The same is true about like the measurement issues, right? That, if you read a lot of studies out there where they use like one relatively simple approach to trying to capture, financial stress, for example. And, we know that those are going to be limited. And I think, our data support that. And I don't have it in here. There's a meta-analysis by Cassandra, I can't pronounce her last name, begins with a P, she's at Maryland. But she found that the correlation between subjective financial stressors and objective was about 0.3. And, and there's probably, as you said, there's a lot of kind of chicken and egg potential reasons for that I think what we need, we need data to sort out, just not say that, well, it could be anything. So let's, not try to study it. You can say that, there's empirical questions here that we can answer with, well-designed research, but it is hard because there is a lot of complexity, it's like for an academic, it's a good problem to have because there's lots of different things you can look at, but it's also challenging in terms of like trying to share the stuff with people and saying that, there's a lot of different overlapping issues that are challenging to pull apart.
Well, Bob, thank you. We are at the hour. And so I'm going to just, again, just say thank you so much. Really appreciate great talk. And everyone, thank you for attending. And we will be sharing information on our next seminars at the website that David posted and also online.
All right. Well, thank you for having me again. And, if anybody has any follow-up questions or you want to email me insults, that's fine. You can find me on the Clemson website. And like I said, I'm happy to share any articles and love to talk about this stuff. So if you got anything for me, just let me know.
Thank you, Bob.
Thank you. And Steve made it.
Yeah, I was here for the last half hour. Thanks, Bob. I'm sorry I missed the first bit.
Okay. That's good to see you.
And you.
You got to get me out there one of these days again for a visit. So
I know. When we can start having in-person seminars again, when the financial climate changes.
Do you know anything long-term about the centers? Like, you just like you're there for the next year and then that's it, or?
I'll give you an update at our advisory board meeting
Okay.
later this month.
Fair
Yes,
enough.
we're cautiously optimistic.
Yeah, that's good.
All right, thanks,
Good to see
Bob.
you.
Yeah, take
All right,
care.
thank you so much, Bob. See you
Bye.
later. Thank you, Leslie.
Bye.